Good afternoon, public policy graduate students. This is Dr. McCarthy, again, your instructor for the course, and I just wanted to kind of go over where we are in the course and what I'm looking for from here. You've now identified your topic or issue that you want to work on from the Affordable Care Act that you're now going to provide an analysis. And you've found some very good topics here for the class. We've got topics, preventive services, wellness programs, nurse-managed health clinics, expansion of the health insurance for children program, and then at-home care for chronically ill patients provided by nurse practitioners, physicians, and PAs, and having insurance companies provide insurance for those people with pre-existing disease. So you've got some good topics here. So now what I want you to do next, over the next week, you've got to do discussion board 5 and discussion board 6. So what I'm looking for in discussion board 5 is to describe the gaps that this particular intervention, this policy, is addressing in the U.S. healthcare system. So, for instance, it might be with the nurse-managed health clinics. Why do we have those? Well, to address the underserved populations, under-medically served populations that have not been getting health care, either because they're too poor, they don't have health insurance. So nurse-managed health clinics came along that took care of patients, at least preventive care of patients, that didn't have any health insurance. Okay, so the question then to ask is, are these clinics effective? And that's the next thing we go on to, which is discussion board 6, is describe the evidence of whether this intervention has been shown to be effective. So with nurse-managed health clinics, have there been some clinical studies done to look at patient outcomes for those that are being cared for here compared to patients that are not cared for in nurse-managed health clinics? So you develop a PICO question for this evidence. PICO meaning if you've taken evidence-based practice, the P stands for patient population, the I is the intervention, the C is the comparison. So similar patients not taken care of in the nurse-managed health clinic. And then the O is the outcomes. What did they measure to show effectiveness? So I want you to go to the literature and find those clinical studies that have shown effectiveness. And I also want you to go to the literature to the experts that have written articles about the gap that this is addressed. So in nurse-managed health clinics, those that have opened up these health clinics, what gaps are they addressing? Why did they do this? So again, this is based on what's already in the literature. You're not looking for evidence of whether this legislation has been shown to be effective, because we know that it hasn't. It's just been recently implemented. But the basis, the analysis here is that a good policy needs to be based on evidence that it already has been shown to be effective. So that's what you're looking for. Has this intervention, this policy, been shown to be effective already? So that's what I'm looking for in the next couple of discussion boards, and I wish you good luck. Okay, bye-bye.